Thank you so much. It's fantastic, isn't it, when we see the chat coming in and you can see all the different parts of the country that that people are in. Weather not brilliant here in Reading today. It's a little bit of a grey day, but I've had reports that the sun is out in different parts of the UK, so hopefully it's shining on you. And really, really good to be with you today for this first masterclass of our third module for the Leadership for Personalised Care online programme. We've got a fantastic set of speakers lined up for you today, and I hope that you will very much enjoy what we've got planned. So if we can go to the next slide, Molly, this is just a kind of a reminder of where we've been so far on our journey. You'll remember that way back in November, we kind of introduced everybody to the concept of leadership for personalised care. And then just after Christmas, we started our second module, which was personalised care in a complex system. And if you had a chance to be part of any of those masterclasses, you'll know that we've had some really great speakers, and they're all of those recordings are available on our YouTube channel for you to look at them again, or look at them if you didn't have a chance the first time. So this is module 3, and it's about collaborative leadership for personalised care. So in terms of making change happen as leaders, collaboration being an absolutely crucial part of what we do. And then looking forward, we've got the module 4 starting in March. So I'm going to introduce you to our team today. So you've met me before. I'm Catherine Wilton, one of the deputy directors in the Personalised Care Group, so I'll be your host. Maggie Woods is the backup host in case my internet goes down. So if I suddenly stop speaking, there might be a short pause before Maggie takes over seamlessly. Our keynote speakers here, I will introduce them in a moment. We've got Alison McGregor, Jane Dawes, 2 more in there, and Judith Lask with us today. Talking about their approach to collaborative practice. As usual, we've got Rosie and Molly in the background giving tech support. So any tech issues, if you just put a note in the chat, and Rosie or Molly will advise you. Molly is the DJ, so if you do have any song requests, you can put those in there as well. She can't promise anything, but she can try. We've got chat monitors, so obviously we can't have a conversation with whole 146 of you in one go, which is a shame. You'll get some chance in small groups to do that, but when we put some questions for you to consider, we will ask Julie and Helena initially to feedback through to the whole group what's going on in the chat. Some backup chat monitors, and you may see Lindsay, Karen, Simon, Kate or John in breakout rooms with you, but if you don't have any with us in a breakout room, that doesn't stop you from talking to each other. We're not there to kind of facilitate or talk to you. It's really for you to get that chance to talk to each other. So if you've been on one of our masterclasses before, you'll know that we usually go through the ground rules. I do think it's important to do this every time, just so that we have a shared understanding of what this space is and the purpose of this space. And we are recording the session, so we will ask for your consent to that. So we don't record the group discussions, but the parts where we've got the keynote speakers or some of the content, we record those so we can put them on YouTube afterwards. There's something about having a shared responsibility for each other's learning, psychological safety, confidentiality, so we do require you to consent to that. I've talked about the tech issues. One thing, I suppose, again, to reiterate, that you get out what you put into this stuff. This is leadership development rather than downloading information that you can take away. It's not about fact, it's about what it means for you and what you're going to do next with it. So the main learning you will have will be in your sense making of the content, and that will happen in the group discussions and outside, of course. But do try to stay on for those group discussions. If you do that, you'll find that you will have greater development than if you just listen to the talk part. And thank you for putting I consent in the chat. So people are doing that already. Okay, so I've given a bit of an overview today on what we will do today, so I don't think I need to spend too much time on that. But before we start, if you could, in the chat, if you could tell us one thing that you took away from the last module if you attended it. So that was the Personalised Care in a Complex System module. Any kind of standouts from that? If you didn't attend it, it can be something that you've taken away from this programme so far. It might have been module 1. And if this is your first time, then you can just put in what you're hoping for from today. Okay, so one thing you took away from last time. And then I'm going to give you just a couple of minutes to do that, and I'm going to call on Julie to just a bit of a flavour about what people are saying that they enjoyed or they took away from last time. What are people saying, Julie?
Hi everybody. So people have said they loved the host leadership. They're looking forward to resonating with the vision. A few others have said host leadership, the role of social prescribing, using that host leadership as a way of framing some good community work and getting some good collaborative approach among stakeholders. Dancing, stepping back and forward. People like the dancing metaphor on last time about stepping back and forward, and the host versus hero leadership as well.
Brilliant. It sounds like you did get quite a variety of things out of that. Helena, anything more that you would add there that's popped up?
I think Julie's captured most of it there. It seems to be there's a few mentions of social prescribers as well, and of the understanding of where that role fits into the bigger picture.
Great, fantastic. And social prescribing, link workers, of course, some of the new roles that have come on board. And I think that those of you who are working in that space will find today's masterclass of particular interest. So if you could put in the chat now, one thing you're hoping for from today. So what is it that you're hoping for from today, or maybe the collaborative leadership module in general? Just stick your thoughts in the chat. And Julie, do you want to talk us through what people are saying?
Definitely. So shared experiences, some real life examples of good practice, learning from others, engaging partners on every level, which is great. Sort of wanting that space to think differently. I think that's been really important. I've heard people say about this program is that it's just sort of give people that stop space to think and have some way of thinking, learning how to influence others.
Brilliant. Thank you so much for that. I think we're going to move on from there. It sounds like you've already got an idea of what you want to get out of the module. And you should have had the course booklet by now as well. So if you haven't had a chance to look at that yet, some of that's covered in there, and I'm sure you'll be picking other stuff up from the 2 masterclasses we've got planned for you. This time we've taken the approach of actually having some real tangible examples of practice rather than just a theoretical approach. So just something to give you that's slightly different from what you perhaps have had before. So the module itself is actually looking at collaborative leadership in the whole. And when we were developing this, we kind of have conceptualized it in a number of different levels. So we're thinking about what we do as collaborative leaders to work with our immediate team and close colleagues. So as team leaders, as line managers, how do we foster an open, honest, inclusive culture and a sense of belonging in our group? So that's a key part of collaborative leadership. Also then the next level might be how you collaborate with others in your organizational group. So perhaps outside your immediate team, to make the absolute most of the asset skills amongst the people within your group. So that might be an organization, it might be a community group, but people who are kind of like not part of your day job, so to speak. Then it's also about collaborating with people who are on the receiving end of services or who are affected by them. So co-production and other forms of collaborative practice that involve people. And then the last level is stakeholders and the wider community. And it's really important to think of both of those things, because stakeholders, you might think of that as collaborating with other organisations in the wider system. So if we're thinking about integrated care systems, ICSs, we might be thinking about those people working at that level, collaborating with local authorities, housing, the voluntary sector. But it's also about how we collaborate with the wider community, local people in general, citizens, because not only do citizens have a lot to bring us in terms of their knowledge and skills and ideas, but they also might be people who might need our support in the future. So we can't just collaborate with people who are using our services now, we've got to be thinking of the future too. So those 4 levels. And the next slide kind of just is a little bit of an overview of some of the leadership skills and qualities. So these are also in the course booklet, and you've had a link to the whole framework, and we've just picked out some of them here along the 4 themes. You would be kind of familiar with these by now. That sense of what does it mean to be a collaborative leader? So kind of a stance which is open-minded, non-defensive, seeing people as assets, and embodying that saying that we heard come through very loud and clear in the first masterclass, and with John Evans, who's with us today, was talking about the idea of nothing about us without us. So kind of really kind of living that, being that. Relating and communicating. I mean, it's all about that, isn't it? It's all about relationships, but a sense of being able to build trust amongst others, having open communication, working with people at all levels and across boundaries, but also then some really core skills about relating, which is about proper listening and emotional intelligence. On the theme of leading and visioning, the idea that you start with place in mind. So if we're thinking about population health and well-being, it's absolutely about making sure that we think about places where people live rather than starting from an organisational perspective, which is a kind of artificial construct. And for that, collaborative leaders do need a lot of knowledge of the local community. You do need to be known down the precinct, or at least know where the precinct is. I don't know if anyone ever saw the documentary a while ago, Can Jerry Robinson Fix the NHS? But one of the main kind of things that he said in there was that importance of walking the floor. So walking the floor in the organisation, or walking the precinct in your community. Skills in dealing with large groups of people and developing and empowering others to lead. So again, that sense of leaders not just being in a positional authority or one person, it's about many of us. And delivering. Somebody put in the chat before about kind of a sense of belonging in groups, so you liked that. There is something here about understanding the psychology behind change and the psychology around groups and collaboration. And belonging is a fundamental universal personal need. We all have different needs for belonging and connection, but actually it is actually incredibly important for people. You'll hear a little bit more from Dr. Mark Spencer in the next masterclass around that. And this is also then about creating conditions for others to lead, we sort of mentioned before, and understanding what matters to people. So that's just a little bit of a flavour of the module. And in today's masterclass, from the outset, we might initially think that we're talking about collaborative practice from the point of view of collaborating with people and communities. But what's so interesting about what you're about to hear from Alison McGregor and colleagues is that collaborative practice, which starts with people and communities, can fundamentally shift the relationship you have with the people who use services and the people that you work with in your organisation. So it's when collaborative practice starts to imbue everything that you do and how it can improve everything that you do. So it's not just if you start with communities, you can improve that relationship. It will actually improve everyone's day-to-day life and create much more happiness and joy at work as well. And I think that's really the magic of this and what I'm hoping you might take away from the module. So that's enough from me. We don't want to hear any more theory, but I will. This quote is the beginning of the work, the booklet, but I really liked it when I saw it from Barack Obama. The best education I received, I can't do his voice, unfortunately, was working with people in the community on a grassroots basis, because what it taught me was that ordinary people, when they are working together, can do extraordinary things. That's quite an inspiring quote, I think. So, without further ado then, I'm going to introduce our wonderful speakers. So we've got Alison McGregor with us today. So Alison's been a partner in the Leadership for Personalised Care programmes for quite some time now, and she's the director of Altogether Better, and we'll tell you more about what Altogether Better does and the amazing impact they've had. Quite a lot working with GP practices around the country, not exclusive, but a lot in primary care. And we'll also then be joined by Jane Dawes, the managing partner, Dr. Simone Ewell, who's a GP, and Judith Lask, who's a practice health champion from the Blackmore Vale Partnership in Shaftesbury, Dorset. So I'm going to hand over to you, Alison, without further ado. Thank you so much for being here today, and we're really looking forward to hearing all about your approach to collaborative practice.
So Thank you, Catherine. It's an absolute delight to be invited to be here today, not least because every time I have a conversation with Jane, Simone and Judith, I hear new things and it just really fills me up again. So thank you for the opportunity to share. The work that I want to share, we call collaborative practice. It's an approach that we have developed, co-produced, co-designed with people in general practice over the last 10 years. And it's, in a nutshell, it's essentially about working together as partners, as equals with people in communities. So general practice invite people to work alongside them, to work on the things that matter. And when that happens, we see magic happen. What I want to do is to start off by just giving you some context and an overview of the work. So I guess there isn't anybody in this audience that doesn't recognise the major change that general practice is currently going through at the moment. No longer is it a place that can just treat and diagnose people. It's had to find a new way of working to respond to the new challenges. And the challenges are not new to you. They're the challenges of people struggling to cope and live and adapt with long-term conditions, with old age, with loneliness, with poverty, with hardship, and often with a feeling of a lack of hope. And so we need to find a way within general practice that is able to respond and meet those needs. And one of our colleagues in general practice came up with just the most fabulous expression, a GP called Neil MacLeod in Exeter, and he said, patients need people, not pills. And those new things that are presenting cannot just be treated, but with a simple medication. We need people, not pills. If we could move to the next one, Molly. So one of the things at the moment that's just really exciting to us is the change in the landscape. So the primary care networks have brought an opportunity to extend the practice family. So we've seen social prescribing link workers, care coordinators, health coaches, a whole group of new people coming into general practice. We've seen a willingness from general practice and primary care to work with partners in the voluntary and community sector. So this is just, it feels like the start and an incredible opportunity to do something different. Molly, could you take us to the next one? So although it's a fabulous start, we think that it's not enough. And that we do a lot of work to look at data with the practices that we work with. And what we know from working with the practices to look at the data is that the scale of need is so great that we're not going to be able to fix it just with some new paid roles. We need far, far more than that. So our data shows that between 40 and 55% of people who present to a GP come with a non-clinical social need. And when we look at that overall in terms of what's going on in the practice, 4% of the practices list take up 20% of the time. That's phenomenal. And then when we look at what's actually going on, when we do rapid patient reviews of practices. And when we look at what's actually going on for those people who come most frequently, one practice recently, we saw that of those frequent attenders, 88% of them had a non-medical need. So we need to find a different way to respond to that. We think that collaborative practice is one of the ways that is a solution to that, and we'll describe it to you as we go through. When we look to the future, when we look at what's coming next into a sort of post-COVID future, it doesn't feel that bright really at one level. So we're going to, we know that there's going to be increased hardship for people in communities. There's going to be an increase in unemployment, poverty. There's a rise of mental health problems at the moment. We know that people will return to general practice, so that there's going to be increased demand on the practice. And along with that, there will be a tightening, a financial squeeze. So we've got off to such a fabulous start with the new roles and the new posts, but that's going to be limited in the future in terms of being able to match that level of demand unless we think about doing something differently. So next slide, Molly. But when we look back at the at what's happened in the last year, it's been full of sadness in lots of ways, but we've also seen some incredible generosity, care, kindness and compassion from people in communities who've stepped forward through the mutual aid groups, people helping with vaccination clinics. A whole range of things have happened that just will give me joy, make me feel really, you know, hopeful about the future. And we haven't been surprised about this in Altogether Better. We've had the sort of privilege of being able to work with, Helena quoted this morning, over 30,000 people who have come forward to gift their time to work with people in their communities or with people in their practices. So the work that we're doing is about how do we make the most of that resource, of that wonderful gift, and do something really incredible with it when we work with practice. Next slide, Molly, please. So we think that general practice is like incredibly well placed to be able to respond to the challenge that's coming up. General practice has the most amazing insight into need within the community. So it's the most robust source of data on need that any organisation has. Also incredible insights from staff about the things that people most need. General practice are also in relationship with people in the community, people on their list who treat general practice with high regard and the regard that they deserve. So they're in a position that they can invite people on the list to come forward. What general practice also is it's a place that people can belong. So Catherine talked about belonging at the beginning. This is a place that can hold this work. So it doesn't need new resource. It doesn't need anything else. It's about thinking, doing and being different and using the resources that's already there. So what we do is we work alongside the practice. We help them to invite people on the list to come forward as champions. And it's humbling. People come forward in amazing numbers. We made a mistake once. Practice put out an invitation to everybody on the list. Usually we do it in batches. The invitation went to everybody. 600 people came forward within a week. And this is pre-COVID. This is just the general normal times. 600 people within a week to give their time to the practice. So we know that there's that huge amount of knowledge, expertise, time out there that if we only just invite people. So people come together, they form a new extended team, a social team, a group of people who work together. So they bring their own strengths, the data in the practice, the time of people in the communities, the skills, the knowledge of what happens in the community, and they do something different. Could I have the next slide, Molly, please? So what happens is that the practice are able to identify the people with the greatest need and able to marry those people up with the right kind of support at the right time. So sometimes you might need a clinician, somebody at the top of the list. It might, of the ladder. It might be that it's a specialist worker. It might be a trained debt advisor, somebody in the voluntary service sector, maybe a bereavement counsellor. But most often, in very many cases, people just need other people. And that's the part that practice health champions play when they work alongside practices. So if we could just go to the next slide. Over the 10 years that we've been doing this work, we have amassed lots of evidence about the impact and the outcomes. And you will hear what it really means from the folks who do this work. But I just wanted to give you the top level stuff. So what we do know is it changes things for staff in the practice. Jane will no doubt share with you some of her stories about the difference it's made to her personally. It improves recruitment of staff. Practices are able to attract staff to vacant posts. They're more likely to retain staff. They have less sickness absence because people enjoy this work. It takes some of the pressure off. It gives them hope. It's incredible in terms of increasing the practice's capacity to do things differently. So the very first practice that we worked with over 11 years ago now, today they have 60 practice health champions who every week deliver 40 new activities. There's no new resource going in. There's just some early work to help them get out of the blocks to do this. And they've got this incredible capacity. when we've done some deep dives into the data within general practice to look at the impact that this has on attendance, what we see is that those people who were coming most frequently, whose needs were not being met because there were social needs, don't need to come anymore. So a practice in Gateshead did a deep dive and they were able to show a 30% reduction in attendance for clinical appointments. Now that changes everything for general practice, everything. A&E admissions fell, and we didn't set out to do that. That was a consequence, that was a knock-on effect. What we also know, and this is proven over and over again, that it improves well-being. So some really high scores, 94% improvement in well-being. In terms of collaboration between people within practices, within PCNs, across organisations, we also see that it improves collaboration. And we did a piece of work in Toronto, and they were able to show that 74% of healthcare providers reported that there was better collaboration as a result of doing this work. So this is not just about working with citizens. And finally, I think it's about culture change. But when you hear the stories from Jane and Simone and Judith, you will feel that. So I would just go to my final slide. And what I would say is, this isn't about general practice working with community. It's not about doing things for the community. It's about general practice becoming an actual part of the community. They're incredibly well placed, incredibly well loved, to be able to bring people to them as that hub, as that place to belong, and to hold something that is, when this happens, it's magic. So I'm going to go now to Jane, Simone and Judith, and hopefully we'll be able to show you what really happens through our conversation. Welcome, Jane.
Hello.
Hi, nice to see you. Hi, Simone.
Good afternoon, everybody.
And Judith, welcome.
Hi.
It's lovely to see you as always, and I was aware I mustn't talk too much because you've got so much to say, and I did probably talk too much. But I want to start off with the beginning of the story. So maybe start with you, Jane. Could you tell us how you came to this work? What brought your practice to this work?
Okay, so when we first heard about Altogether Better, I have to say that we were going through quite a difficult time in the practice, like everybody else in the NHS. It was really, really busy. Everybody was, or kind of felt that they were on their knees. And we had recently, before that, had a bit of a bashing in our GP patient national survey, which just said the results were just quite poor, and we were a bit upset about it. And so kept hearing about Altogether Better from another practice, which was quite annoying. And I went along quite reluctantly, thinking, this is just another bloody great idea from the NHS. Haven't we got enough to do? How many projects have we done that have achieved very little? So I went along, and I think it was 8 sessions, so quite a big time commitment. Went along reluctantly and had 2 other members of staff, and our social prescriber at that time came along as well. And from the moment I arrived, Martin, who works alongside Alison, who's got a brain the size of a planet, what he did is challenge the kind of narratives and the stories that we have told ourselves over time. And so we were in the position as a practice, and someone will probably articulate this much better than I can, but we were kind of in that sort of thing where we were working really, really hard. Patients were dissatisfied. Nothing we were doing was changing anything, and we were kind of in that sort of feeling of, actually, if only bloody patients did as we told them to, we wouldn't have these issues. You know, we were struggling to recruit GPs. Workload was absolutely through the roof. So we were kind of almost, I think we were projecting that, and our staff were absorbing that kind of patients are the enemy. And if only, you know, we'd be all right if it wasn't for the patients, kind of thing. So went along to this, and what Martin, we were articulating this to Martin because he asked us, you know, what's it like in general practice for everybody at the moment. So we were all having a good old whinge about it, and he just kind of, it was like a nuclear bomb, really. He asked us the question. Well, he said to us, "Why do you think all of those people are coming so frequently?" And it kind of stopped me in my tracks. And what he said is they're coming to you because they still trust you, because you're held in high regard, and because they've got nowhere else to go. So their needs are not necessarily clinical needs, but they need to be addressed in other ways. And so that was the start, really, of working with Altogether Better. I have to say, it was the most, I've been on many, many NHS courses, projects, you know, I've been around for far too long, really. This is the first time that I felt, I came away, even from the first time, and just thought, do you know what? We've been focusing our attention absolutely on the wrong stuff. This is where we need to spend our time.
Thank you, Jane. Just to make this real for people, so can you tell us what you do now that you didn't do before? Maybe start with Simone this time, and then we'll come back to Jane and Judith.
So I think for me, that leading on from what Jane said, you know, if I'm really honest, I always used to see patients as foe, and, you know, sometimes an irritation. And I went to, before we did Altogether Better Pro, I went to a commissioning sort of conference, and a patient stood up and just talked about how their practice made them feel. And I sat there and I thought, oh my God, that's exactly what, you know, how I'm probably making my patients feel. So it was really about creating the culture as patients as friends, not foe. And I think that for me has been one of the main things that I've learnt, and that we do differently now, is that, and also we invite patients into the practice, whereas before we were always trying to keep them at arm's length, you know, those closed doors, the Rottweiler receptionists. And it's really trying to change that culture, as actually, you know, we're here to help patients. And actually the thing about Martin and what you said earlier about 40% of patients that come to us, and they do have a non-clinical need, it's like, my God, you know, how can we support those patients differently so that they can achieve their needs, and then we can focus on what we really need to focus on. So I think seeing patients as friends for me was the main thing. I think, and also actually a holistic approach to healthcare, and how I think traditionally, you know, I've been a GP now for 26 years, so I'm quite old in the tooth, but it was a very paternalistic way of practicing. And it's actually now, it's about patient self-empowerment. It's about bringing them, as you say, into the community, and how we can solve their problems together, or even how they can solve their problems for themselves. So I think that was really key for me. So yeah.
So could you, one of you, Jane and Judith, tell us what actually happens now? What does it look like? What kind of things are happening now if we were to visit your practice?
So I think prior to COVID, so things are a little bit different now, although they have, some of those have gone online, which Judith will be able to tell you about. But things have been really quite different. So we invited, once the Health Champions got going, they are part of our extended team. And there isn't this barrier now that was there before between us as the professionals and patients as the passive recipients of our, you know, like Lady Bountiful, our knowledge and skills sort of thing. So they have come up with all sorts of ideas around projects. It's been very liberating for us to be able to say, we don't know whether that will work, but let's give it a go and get going with that. And they have done, and they've gone ahead and just done an amazing job. So a couple of examples is we've got 2 community gardens out on practice land, a new one that started recently. We haven't done a single thing for it apart from saying you can use our land, and there's 100 volunteers involved in that. working with local schools, local community, etc. It's a very, I think, but Judith will be able to confirm or not, it feels very different because we involved our staff. So it wasn't just me, it was our staff, about changing this relationship with our patients, that it isn't them and us, actually we're all in this together. And that, guess what, shock horror, patients might know better than we do, and actually have the skills and experience more than we have to do some of these things. So we have small things that make a difference, such as when they come in, we have what's called happy to chat benches that are there so that prior to COVID, people could come in. If they wanted to chat to somebody, they can sit there, somebody else will join them. We had a wonderful volunteer, a champion, who said, oh, it'd be good to encourage reading at home. And she said, and if we do, I can make some bags for children to take books home. So we put out something on social media, on Twitter or something. We had 2,000 books within about 2 days that have been donated to us, high quality books. And then we had, I don't know, hundreds of these lovely little backpacks that were handmade by people hanging up in the practice, so that when children come into the surgery, you know what it's like, everybody's been, it's quite a sterile environment where you sit there, nobody's looking or speaking to anybody. Children running around, lots of patting, you know, about children and things, making a noise and being a pain. Actually, they get to go and choose a bag of books, and then they sit there and they read them, they take them home. If they want to keep them, that's fine. If they don't, they can bring them back. But again, it was just giving permission, I guess, or just allowing people to actually do that, and we don't control that. And we just thought, God, that's a lovely idea. Yes, let's do that. And I think one of our greatest successes is the Health Hub, which I'm sure you'll remember this, Judith, when we first got going. One of the first projects the health champions wanted to do was to set up this, they wanted to call it Health Hub, in the surgery, in the waiting room. And first of all, we thought, oh God, we've got to get a committee, then we've got to do minutes of meetings, and we were spending lots of time talking about that. And we just said, why don't we just set a date in the diary? Let's just do it. And people were worried about what happens if somebody asks me something and I don't know the answer, or if it's a clinical issue or something. And we just said, let's just do it and see what happens. And so we had, Judith was one of those, and a number of other people who came, and what they do is they sit there and, shock horror, they talk to people. And it just changed the dynamic of the waiting room from this sterile, slightly intimidating, quiet space to something that was buzzing with friendliness and warmth. They offer tea and coffee to people, which kind of facilitates the discussions, and tea and cake. And Judith always brings in lovely flowers. So it looks so not like a GP waiting room. And people, and Judith will be able to tell you this, people tell their story. And then if they need to be referred on or signposted somewhere else, they can do that. We've got hundreds of examples of things that they have done, which has just been amazing. But I'll let Judith tell you about from her point of view and how that's worked for her.
Yeah, the first thing I'd like to say is, sort of listening to Simone and Jane, it's very clear that they had done some good work before they invited the health champions in, because my experience as somebody who had recently moved to the area, so I'd had a number of GPs in London before, and is how different the GP practice was. And, you know, the whole dialogue around patients was already very soft and welcoming and caring. And the way that they invited us in as health champions was great. And, you know, I think there are symbols of this, like, you know, we have a badge, okay, and we also can use the staff kitchen. So I think that's a symbol of how embraced we were as part of the team. So I can only think a lot of work had gone on before that in getting to that point. So yes, the Health Hub was wonderful. I've never been, I was slightly skeptical, you know, I have a sort of health service professional background. I thought, you can't just, you know, you have to plan it for 6 months and all of that. But no, Jane was, yeah, we just go for it. And so were some of the other champions, which was great, because I'd have held it back, you know, till we've got all the rules and policies.
And a nice risk assessment.
Yeah, absolutely. But we did it and it was wonderful, you know, and people used it so many ways, you know, sort of, you know, I'm thinking of we had some quite elderly farmers who used to love the cup of tea after they'd had their consultation, and just what they wanted to do is talk about farming. They wanted to tell us about farming. Other people might have had an upsetting consultation in some way. Maybe they'd had a bereavement or something and just wanted to chat around it, you know, and a bit more time than obviously a GP can give. So that was great. So, you know, then this wonderful group of people who arrived out of Shaftesbury as health champions, some involved in voluntary organisations elsewhere, some with particular medical conditions and expertise in that way. Just brilliant. I've learned so much from them and made new friends. And out of this group arise all these different things. So this, we're all online now, but there's sort of mental health support group, fibromyalgia support group. My particular pet thing, I'm just trained as a mindfulness teacher. So I have a weekly mindfulness and chat group, which I now online have 10 people, but regularly every week. I've run about 4 different mindfulness, introduction to mindfulness courses that, you know, people have enjoyed and so on, because I think that's a great sort of general resource for people. It's not a treatment, it's a resource. There's the pantry, which is just amazing. Brilliant and amazing, which is like a food bank for sort of people who are adults in a way. You know, it's not giving out charity. It has more of a, you're a member and you get a good deal on food items and so on, really needed at the moment. And there are lots of people in the Health Champions who do other things like walking for health and so on. And we've invited to our regular meetings people who are involved with other charities and organizations outside. So we get to create this sort of knowledge network, which we can then feed to people. So it feels very organic and alive, and I'm sure lots will happen when we can all get together again too.
Thank you, Judith. I mean, I just think it's utterly fantastic. A sentence Jane spoke to me last week was that the pantry is fed at 600 people.
Yeah.
You know, this is not a week. This is not small scale. This is life changing. But the thing that I think is so sort of sophisticated about it is it's not doing things for people. It's doing things in such a respectful way with people. And it really speaks to that. A story I remember was that when you first went into the first lockdown, you sent me a picture, and it was a picture of a banner that was outside of the health centre, and it had been made, a huge, huge banner. You tell that story, Jane.
Yeah, so I arrived at, no, I was leaving work one evening. It was in the summer months, I think. It must have been because it was light. And I turned around just about to get in my car and I thought, oh my God, there was this huge, massive, massive banner which had been made by somebody. We still don't know who it was. And it was done sort of like quilting, if you like, and put together by local people just to say thank you for everything that everyone is doing in the practice. And we have literally only just taken it down because it was getting very dirty. And we are going to try and get it framed and have it put up on the wall, because it's just beautiful. It really is. And it was just such a lovely thing to have. And we still don't know who did it. So, yeah.
It's fantastic. So one of the things I wanted to ask was, we've talked about changing relationship. It was about what it's meant to you personally and what's meant to you as a practice. So maybe start with you, Jane, just a couple of minutes around what's made a difference.
I'll try and be concise. So as I was saying before, I think I was probably on the verge of burnout, pretty fed up, really sort of counting down the days to retirement, because just sort of worn out by the whole, working really, really hard, but somehow not getting it right. Patients still feeling that we weren't meeting their needs, and therefore there was some frustration and stuff. So, and what I had lost sight of personally myself is, why do I want to work in the NHS? And what this process did is it reminded me what really matters to me about my work. And that is what is it that motivates me? And it was, what really matters to me is providing a great service to patients and also looking after our staff. Those are the things that really matter to me personally. And I really had lost sight of that in the work that we were doing. And I think most people in the NHS probably have as well, just because the volume and the stress of the work is so immense. And so what this allowed me to do is really to unpick that relationship, or this barrier that we had between us and patients, and actually spend time with kind, gifted, talented, funny, clever, caring, interesting people, and who were doing all of this to us, which for no reason other than they wanted to help. And that in itself is just so totally heartwarming. We hadn't seen that. We had this sort of slightly combative relationship with our patients. And it was just, I think I've said before, Alison, that actually what it meant to me is I actually had joy in my work. And I looked forward to it every day. And if it was a day when the Health Hub was there, or we were going to do something, we've got an LGBT group, we've got a veterans group, we've got all sorts of other things. If I was doing something for that, it was like a treat. It really was. And what we started to see is patients, our staff they got to see it too. So they came out in the Health Hub, they'd come and have a cup of tea or their break with the health champions. Imagine that, staff and patients actually mixing together in shared space. And everything just got better. It was just nicer. Everything was nicer. Patients were nicer. Our staff were then nicer to patients. It's a win-win. Everybody is happier. And I'm not saying you don't get any problems. You do, obviously. But it just brings some nice, kind, compassionate relationships into general practice.
Thank you. I've got like 3 minutes left on the time that I've got, and so I'm really keen that Simone, that perhaps what would you like to end with? What would you like to leave people with?
So I think some of this is about you have to invest time and effort at the beginning. And again, when we first heard about the Altogether Better programme, we were like, oh, not another initiative. And we missed the trick. We missed a trick. And it wasn't until the next practice down the road, we're going, this is amazing. We were like, oh, hang on a minute. We really have missed a trick. So invest time, it's really crucial. I think relationships and trust are really, really important. And I'm just sitting here looking at Jude, and she gives up her time willingly, free. She comes to a social prescribing huddle every Tuesday morning. We interact with all of our team. She's been supporting our carers, and I feel overwhelmed that people are able to support us like that. So I think we have to trust and have really good relations and respect for our patients. And I think start to just create different attitudes from clinicians. We are all in this together. It's not just about clinicians. It really is about that holistic approach to healthcare, and we can't do it by ourselves. And I put in the chat, primary care networks are a really good opportunity, to have that holistic approach. We've got the additional roles, we've got our teams, and we need to be able to be creative in how they use them.
That's really perfect. Judith, what would you want to share with folks?
Well, I'd just like to say that, if the context around you as a health champion, like it is at Blackmore Vale, welcoming, supportive, safe, always, if you're worried about anything, etc., it's the most wonderful thing to be doing. So, don't worry about inviting people to sort of give up their time, because it's an absolutely joy to be with people in a team and doing something that certainly I think is enormously worthwhile. You know, the whole, you know, of course, you know, physical health is also about mental health, is also about social context and relationships. And if you lose that, you're seeing such a small part of the picture.
Thank you so much. We're out of time. I've got so many questions. I could ask and ask and ask, but I know that you're incredibly generous about sharing your experience. So there's lots of things that you can read about what's happened at Blackmore Vale and other practices. And I know that folks are really happy to share what's happened and talk. So I'll pass over to Catherine now. But thank you all for your time this afternoon. It's a pleasure as always. Thank you.
Absolutely, and from us a big thank you. And just to let you know, there's been sort of a huge amount in the chat telling people how inspirational those stories are, and I think people are a bit jealous, saying either they're going to talk to their own GP practice or trying to find out now on Google probably exactly where you are so they can move house and register with you. So really fantastic story. So we're going to have some time now. We're going to go into small groups to kind of discuss some of the things that we've heard. So Molly, if you could just put up the questions, and what I'm going to suggest is that people take a photograph of them. We'll put them in the chat as well, but if you, there's sort of two ways. If you just take a photo of the questions, it'll help you remember them. So just two questions to discuss when we put you in the small groups. What can you learn from this approach to working collaboratively with people and communities? And what could you do next? And there's a couple of caveats to this, of course, because this has been very much a general practice example, but we think that it's applicable everywhere. So it's a kind of imaginatively thinking about, well, how would this apply in my work, wherever you are in the system, whether you're in commissioning, whether you're in a different organisation, a different sector altogether. That idea that inviting people in, so going back to the host leadership model, that inviting people in and asking people to collaborate with you to make to create health and well-being, to make people's lives better, is actually something that we can kind of learn on elsewhere. So what could you learn from this approach and what could you do next? So Rosie's going to put you into breakout groups in a moment, but just to say, keep your camera on if at all possible, because the connection with each other is very important. Quickly introduce yourselves to each other. You might want to reiterate confidentiality between you and make sure everyone's got a chance to contribute, and don't wait to see if one of our facilitators turns up, just go for it. So do enjoy your discussions, and we'll be back here in about 25 minutes. So your conversations. Welcome back from your discussions. I hope they were enjoyable and that you got something out of those conversations. So welcome back, everybody. Are we all in, Rosie, do you think?
Yes, it looks like we are.
Fabulous. Okay, so we've got about 9 minutes left. It'd be really just great to get some feedback from you from those discussions. The first question then, Molly, if you're able to stick the slides up, and then we're just going to be asking you to stick some thoughts in the chat. So the first question is, one thing you've learned or taken away from today. It'd be really interesting to hear what you reflected on as a result of what you heard and what you discussed. So one thing you learned or taken away from today, stick those answers in the chat and let's see what's coming out. And as they start to come through then, Helena, do you want to give us a bit of a readout? Yes, indeed. So a few people saying didn't know health champions existed, and acknowledgement that collaboration is definitely the way forwards, and a sense of giving people a sense of belonging and working together. People impressed by the energy, and a repeat of Alison's quote of people need people, not pills. Lovely, thank you. Anything else to add from that, Julie?
Yeah, I think there were one that that's just sort of flown by, but it was sort of the don't get caught in red tape and work with the willing, you know, so some really good tips and seeds, I think, have been planted today. And certainly in the group that I was in, they were sort of saying, you know, there's a real small window of opportunity now to take the really good community spirit and the mutual aid culture and really bring that into our work and embrace it and keep it precious.
Yeah, absolutely. I mean, there was just so much goodwill and a mutual aid that sprung out of this, the awful situation with the pandemic, wasn't there? So how do we capitalize on that? So much goodwill of people wanting to help others. Absolutely brilliant. Fantastic. So the next question then is, what might people do next? So you can see the question there. One thing you're going to do as a result of this masterclass. And that could be a small thing. It could just be do more reflection on it. It could be share the materials with one other person, or it could be you've had this amazing idea for a project and you're going to start it tomorrow. So share with us in the chat what you think you might do as a result. What's coming through, Helena?
We've got people saying we're going to stick to their guns, to keep shouting about this work, share it with others in their organisations, and trying to kind of push down those barriers. Recognition about the untapped potential in general practice, new ways of working, looking at sharing information, somebody making a short film to share with PCN colleagues to introduce them as collaborators, not outsiders. Comment about just get on with it like we did during COVID, and to lead by example. So it seems like people wanting to just kind of spread that message about the impact that it can bring to invite other people into general practice or into organisations.
Fantastic. Anything you want to add, Julie?
Yeah, I think Helen's covered it really, really well. There's one that said, you know, we need to be asking for forgiveness, not permission, and get it fun. You know, how wonderful for everybody to be coming back to work after the pandemic and feeling joy and fun. That'd be great.
That was definitely something that came through for me, was that sense of joy, joy in work, and that, you know, that kind of love and connection with people. We're all craving it, aren't we? So a collaborative approach kind of helps meet our needs as well as the needs of others. So fantastic. And I think we've got a poll next. Is that right, Rosie? So we've got a poll now. So this is just to leave us with. So on a scale of 1 to 10, how committed are you now to developing your collaborative practice? So do vote, and we'll see from the people that we've got here your level of commitment. Wow, look at this. Quite a high level of commitment already. So 36 of you have voted. Do get voting. And we'll close the poll in a few seconds, and we'll just then see. Oh, it says polling is closed. Is that right, Rosie?
Sorry, I'm not sure what happened.
Try again. So let's see. It's nice to see what everybody else thinks as well, isn't it? So we're going to open the poll again. So even if you voted already, don't worry, we're starting again. So what's your commitment on a scale of 1 to 10, where 1 is low? And obviously there's no judgment. You know, there might be things that are kind of barriers for you at the moment. That's absolutely fine. But 71 people, so about 3/4 of you voted already. And it does look there's quite a high commitment here, which is amazing. So absolutely brilliant level of commitment there. I wish you the best of luck. So we can take the slides down, I think. That we can just see everybody's faces just before we leave on our gallery view. So if we take the slides down and have a look at each other. If I needed to press gallery view on there, so you might do as well, so I can see you all now. It's absolutely been a pleasure to have had Alison, Jane, Simone and Judith here today. Thank you so much to our key speakers and all of the team who've been involved today, and thank you for everyone who's participated. And I wish you the best of luck to take with you any inspiration that you've had today in how you build collaborative practice into your work with your teams across organisations, with others in your organisation, and with people in communities, because it's the essence of personalised care, really, this way of being. And from the people that once you start doing it, you'll never go back. So the best of luck. Have a great day, and don't forget, we've got another masterclass next week with
Sorry, Catherine, you've just gone on mute.
Don't know what happened there, sorry about that. So we've got another masterclass coming up next week with Dr. Mark Spencer, who's a GP, and Kirit Mistry, who's actually an alumni from our national programme, to talk about collaboration, collaborative leadership, and working with communities as well. So it's a similar theme, and also and lots more stories of people who've put this into practice. Look out for our newsletter. Hope you're enjoying those. If you they look great on Outlook, not so great on a phone, but you can always click and you can see the online version if they're not coming out quite right for you. And just lastly, before you leave today, if you could fill in our evaluation form, it really is only a few questions, but it helps us, one, tailor these so that it's meeting your needs, and also it helps us know if we're kind of making a difference to you, because if it is, then we'll continue doing it. If it's not, we'll go and do something else that's more helpful and useful. So thanks very much, everybody. The link to the evaluation will be in the chat. And then we're going to put some music on to play you out. Thank you very much.